Make it make sense. Third degree heart block. So this is an example of a third degree heart block. It has a classic sign of having the P waves march out consistently and the QRS complexes march out consistently, but they are not communicating together at all. I always found the block song to be very helpful when it came to understanding how all the AV blocks actually work. And per the block song, it says if the P's and Q's don't agree, then you have a third degree. So that's exactly what this looks like. We can see that on this third degree heart block EKG strip that all the P to P's are going to be marching out very consistently. We can also see that the R to R interval is also going to march out consistently. However, there is no consistent PR interval. There are more P waves than there are QRS's. You can just tell that they're not meshing together. There is no communication at all. And sometimes those P waves are actually going to be hidden in a QRS. You can see that by the second blue tick up at the top, that P wave is actually hidden in that QRS. On top of that, the rate of the ventricular rate that you are going to see on your monitor is really going to be dependent on which escape rhythm actually occurs. And there's two that usually occur, which is going to be junctional or ventricular. Normal conduction happens through the SA node, down through the AV node, through to the bundle of His, down through the left and right bundle branches, and then through to the Purkinje fibers, with each of these having its own individual rate associated with them. When we have a third degree heart block, there is a dissociation between the SA node and the AV node, or a complete failure of those impulses to pass through the AV node, which you can see here. The SA node will continue to fire at its regular rate, which is why we have more of those P waves compared to the QRS complexes. Due to this dissociation, there's going to be a backup pacemaker, and in the junctional escape rhythms, we're going to have that be at the AV node or the bundle of His level. If that happens here, that backup pacemaker fires at the AV node or bundle of His, you're usually going to have a rate of about 40 to 60 in a narrow QRS. Now in ventricular escape beats, which you can see right here, you will see the backup pacemaker for the ventricle occur below the bundle of His, which is going to be at a lot slower rate, around 20 to 40, and oftentimes be associated with a wider QRS. Hopefully that helped clarify third degree heart block and specifically if it is going to have a junctional versus ventricular escape rhythm with it. Let me know if you have any questions. Don't forget to comment below and save this for a reference in the future.